Hi, Mwangi, and welcome and thank you very much for joining us again to discuss Africa and the COVID crisis.
Thank you so much, Henry. I'm happy to be here.
Brilliant. Well, I thought we might start with a broad update on where things are 3 months on from when we last spoke.
We last spoke middle of May, so roughly the same time. And at that time, Africa, as we noted, was at the bottom of the curve in terms of infections. And so since then, there's been an explosion in terms of the number of infections, at least reported infections. So we moved from 200,000, which is where we were around that time, to now 1.4 million is the latest number.
Blimey.
Although it seems, and more recently, we started seeing reports that most people, or at least experts, epidemiologists, are seeing looks like it's already hit the top and is coming down in many countries. So the overall curve seems to be dropping off in terms of number of infections on a daily basis, with the exception of some countries. Morocco is still rising quite rapidly. But most of the other countries, most of the other larger countries, seem to be leveling off. So just to give you an idea of the countries, South Africa is the largest and still counts for close to half the infections, at about 600, just over 600,000. And then it's followed by Egypt, which is just under 100,000. And then Morocco, Nigeria, Ethiopia, Algeria, all are between 40 and 60. And Ghana as well. And then below that, Kenya at 34. And then every other country is below 20,000 infections at the beginning of this month. So, so we still have relatively low infection rates. So in terms of infections per million people, African infections as measured right now, the average is about 1,000 people per million. Compare that to Brazil, which is 20,000 people, nearly 21,000 people per million.
And India?
Let me give you the United States is at 20. India is at 3.5 thousand. Right. So India is about 3.5 times the African rate. Now, the African rate, obviously, there are 54 countries, so there's huge variation. At the top is South Africa with about 11,000 per million. And then, you can go all the way down to about 400 per million in places like Rwanda. Now, the question is, what explains this?
Yeah.
What explains this, right? And to some degree, it is testing. I mean, Africa has much fewer tests than all the other places. So if we take, with the exception of South Africa, if we look at the same countries we looked at, South Africa has 66 tests per 1,000 people. The United States is doing just under 300, and the United Kingdom is doing 250 per 1,000 people.
Right.
So it's relatively less. The South African rate, the share of positive tests, though, is much higher than those two places. So in the United Kingdom, it's only 2.2%. In the United States, it's 6.6%.
That's the percentage of people tested.
Of the people tested, how many are testing positive?
Right.
Okay. So if you look at
what percent of South Africa of those tested are testing positive then?
Of South Africa, it's 16.5.
Oh, right. So that's very high.
So that's very high. But it's very high even relative to other African countries. So if you look at the other countries that we have some, what I would consider reliable information on testing. So Senegal, Kenya, Ethiopia, they're testing about 10 per 1,000, and their rates are 5.6% in Ethiopia to 8.5% in Senegal. Kenya is in between at 7.2%.
Okay. And what about the death rates?
So the death rates, the number of deaths has gone up. So the number of deaths in May was about 2,396, and now it's 32,000. So if you take the mortality rate of those who were tested positive, right? So this is not overall, this is just of those who were tested positive. It's gone from 1.2% to 2.3%. So it's gone up quite a bit in terms of those who've been tested. So we've seen increases, but we haven't seen, and what people are puzzled about is that we're still not seeing, even given the tested, because, so for Brazil, for example, they're testing 24 people per 1,000, and they have an infection per million of 20,000, right? So it's not, so even if you said, okay, let's take Brazilian, amped up most of African countries to Brazilian rates, the number of, we would have to be missing very many people who are infected. There have been some limited antigen studies which suggest that there are large numbers of people who have been infected who have not been tested, right? So there was one in Kenya, there was one in Pemba, off the coast of Tanzania, in Mozambique, and those give us anything from 5% to 10%, so roughly the Swedish numbers in terms of infection rates. But we're not seeing, at least reported, the large number of deaths. So even if there is a larger number of infected people than we actually are seeing reported, which I believe they are, that there is a large number, that these numbers are underestimates. But even if there is that underestimate in terms of deaths, in terms of both anecdotal evidence and evidence from hospitals, they don't seem overwhelmed in the sense that we're seeing things reported in, for example, Latin American countries.
Right.
So there's still a puzzle out there. There's still a puzzle.
And what about the policy response? I was just talking to Supi about an assistant professor in India about the Indian situation, and the policy response there seemed to be initially a very hard lockdown, and then nothing almost, and almost trying to sort of cover up their doing nothing by turning it into a sort of culture war, which sort of seemed to have sort of a US overtones in terms. So there's no policy response in India, seemingly, to generalize anyway, apart from some few exceptions.
Right. So the same, so kind of Brazil, India, and the United States had somewhat similar approaches. And I think that given the limited resources African countries have, there have been a number who have, responded quite well. And, the one that's highlighted most is Senegal, which started with a lockdown. The African lockdowns were not complete in the sense that people were quarantined in their homes. I mean, most of the African lockdowns involved restriction of traveling from regional travel, alongside curfews, and then limitation in terms of large numbers of people meet. So,
Right.
but they were pretty early, they were pretty fast, and they were pretty serious. And so I think they did have some impact. They had some impact.
Markets with, I suppose because of the large number of people meeting in markets together, and that would be quite presumably economically significant.
Yeah, they didn't completely shut down everything. I mean, it was different country to country. In many countries, some of the work continued, but there were curfews, so that you could be out to work, but then you had to get back home. Many of the markets, other than in the cities, are open air markets.
Right.
So it might potentially be the case that that kind of congregation may not have had as large an effect as people congregating within closed spaces.
Yeah.
So that was the initial response, and then they went to testing and tracing, and that has been improving over time.
And Senegal is one of the leading ones in terms of testing and tracing.
Yep, Senegal has right from the beginning, I think we mentioned this in our first COVID interview right at the end. We talked about, Senegal immediately started developing locally a local test kit. And so it's got a very rapid response test kit. You can get your results definitely within 24 hours, sometimes even within 2 hours. So they move very rapidly along those lines. So they have
Senegal that allowed them to respond so effectively.
I would say a couple of things. I think one, a great amount of trust in the government. Presently in the government of South, there's a fair amount of trust. Secondly, combining that trust with compliance, people complying and understanding the disease, that you're not just protecting yourself, but you're protecting other people. So this question, which has been raised in places like the US and Brazil of individual freedoms not to wear masks, etc., has not been a question in places like Senegal. And then third, something we had talked about earlier is that the experience of Ebola has given them a blueprint of kinds to approach this. And so the first few things they did was actually the same thing they did when, the West African Ebola pandemic, well, it wasn't declared a pandemic, but the West African Ebola outbreak occurred, shutting down borders, restricting regional travel, and testing very quickly. And what Senegal has done, which is, I think, a step above other African countries, is also they've been able to take people who are infected immediately out of their homes. So they're not leaving infected people. So you're not being quarantined with your family. You're being immediately taken out and getting a bed elsewhere, whether it's a hospital or a converted hotel. So I think that's helped them restrict the spread of the disease quite a bit.
Wow. And if they're at the sort of leading edge of being effective in terms of responding to the virus, does that help them at all economically, have a less bad economic experience? And what is the outlook? Because they don't have a very strong economy, do they, as far as I understand it?
Yeah, I mean, strong relative to other African countries, it depends on how you want to think about it. Yeah. I mean, but they're not, so they're not amongst the strongest, but they're not amongst the weakest of African economies. But I think the challenge here with with COVID is that everybody's getting hit regardless of what you do.
Yeah.
I mean, the world is so interconnected in so many ways that, just like, to give a example that people may be more familiar with, at least in the West, is that Sweden's GDP dropped quite a bit despite the fact that they didn't lock down, right? Because if other people around you lock down and, all the value chains are interconnected in some way or the other, then it doesn't matter that you remain open. You still get affected. Now, in Senegal's case, I think they'll do better than other African countries. They've had the capability, they've had one of the more robust fiscal responses. So they've managed to pump in about 7% of GDP in terms of response. It's nowhere as large as Western countries, but it's a significant response.
And how have they managed to do that?
Well, they've just had better fiscal space.
What does that mean?
So they both, I believe, in terms of budget deficits, particularly they weren't running large budget deficits. They weren't too much in debt. So they were able to respond faster. They had a decent system of social support, which they were able to expand to more people. So they had that basically in place. So those are some of the things that they had going for them, that they could expand a little bit faster. They may also be, they're not as large a country as others, so they're less than 20 million. So
right.
that makes it easier just to respond. So that's, I think those are some of the things that have allowed them to be able to respond much better than
to international trade. And I mean, do they have much of an indigenous economy? Is there a level of self-reliance?
In some things, I'm not sure that they're any better than other African countries. I haven't looked closely to see, let's say, food imports or something of that nature. I'm not sure that they're much better than the top. I would put them in the top third of African countries, but I'm not sure that they stand out in any particular way.
Okay, because they are relatively stable, aren't they? And in terms of governance, they get very good scores, don't they?
Yeah.
And
yes.
The story from the likes of the World Bank is if you get your governance right and you create the right conditions, then you should gain, that should help you. How far has it helped Senegal?
I think it has helped them. I think the fact that there is trust in the government has helped them quite a bit. But I do want to say again that I don't want to. I think they've done a number of things right. And so there was this recent study by Foreign Policy, which placed them second in terms of their response to COVID, right? And it placed them second. The measures were looking at pre-COVID conditions, and then the public health directives, the financial response, the communications, and then kind of overall rates of COVID-19. But I do want to say, although they were placed second, there were 36 countries in that study, and 4 of the 5 African countries in that study all ranked above number 15.
Okay.
So, South Africa ranked at number 10 in terms of response. Kenya ranked at number 11, and Ghana ranked at number 14. So they all beat out the UK, which ranked at 18.
Right.
Yeah.
Yes.
and the US, which ranked at 31. So whereas there is a difference between Senegal's scores. I mean, New Zealand's scores are kind of off the chart, and then Senegal is distinctly ahead of the next group of countries, which include Denmark, Iceland, Saudi Arabia, Belgium, Australia, Germany, and up to Germany. And then you get this another group who includes the South Africa, Kenya, and Ghana group. So they're distinctly ahead. But again, I think a number of African countries have responded quite well. Now, the flip side is there are some African countries who have responded very bad.
Right.
Right? I mean, we know of Tanzania's case, which just stopped testing, the cases of Madagascar and supposedly local treatments, which it was exporting. So there are countries that have responded very badly as well. So there's both good and bad news on the continent.
Do you think, just looking forward, a lot of these countries are going to be hit very badly by climate change as well? And I think Senegal is quite vulnerable, though funny enough, I talked a bit ago to someone who sources fruit and vegetables around the world for supermarkets here.
Yeah.
And his organization is betting hugely on Senegal as a long-term supply of fruit and vegetables for the world. So, because actually his assessment was actually with the Senegal River too bad. But I wonder if you can sort of beat COVID-19, does that mean you're better placed to put in the sorts of resilience, support mechanisms people will need as the climate gets worse?
Yeah, I would say so. If there is something, if we can say that there's something in the governance, that part of this was a governance response, and kind of, as the foreign policy report has put it, kind of a scientific response to the crisis, right? That's how it's tried to measure this. Then it may put you in a better position. I think the challenge is going to be that we're going to have to think differently. I think African countries are going to have to turn to each other post this crisis, because I'm not expecting that there'll be, there's not going to be a global V-shaped recovery. And so your traditional markets are not going to be the places where you'll necessarily get growth. The one thing that they have going for them is that, the African Free Trade Area has, the agreement, the African Trade Agreement had just been inaugurated a couple of years ago, and that is being signed on to by more and more countries, and increasingly trade between African countries has increased. I think now African countries will have to consciously, some of that has been pure luck, not necessarily policy driven. I think African countries will have to consciously turn to each other in terms of who they're trading with and looking for opportunities with each other as part of their trading strategies, rather than just turning west or east.
But how does that relate to a strategy to cope with climate change? Because the agriculture is going to be hit very badly. There could be probably huge migrations of people moving away from areas where it's just impossible to live.
Yeah, I think we sometimes make, and I want to say this without diminishing at all the risks of climate change. But, countries internally and Africa as a whole is very varied, right? So the impacts could be quite different in different places. Folks are always surprised when I say, well, I go to Kenya when it's summer over here, and it's literally much cooler there, right? And up in the highlands,
Yeah.
we're at 2, 3, 4 degrees Celsius. So it can be quite cool. So I would, I think it's not going to be, it's not one size fits all. I think that there's going to be variation in how people are affected. And clearly, we have the capabilities to feed people and to produce quite intensively if we get certain things right, okay? Let me give you a simple example. I mean, it doesn't count towards food, but it gives you an indication of what is possible. Kenya produces 40% of the flour of some of the flowers, so which are in the EU market.
Yeah.
Right. So it's the biggest exporter of flowers. That's done on only 2,000 hectares of land. It's 2,000 hectares of intensively farmed land.
Yeah.
Okay. So,
which is environmental problems.
Pardon? Yeah, it has its environmental problems. But my point is that there's this very high intensity production, right, that does take place. So I think when we think of response, while I think we need to adjust in order to respond to the environmental problem, it's not the case that, let's say, for example, all of Kenya will become, something like the Sahara, right? And so it's possible.
Desertification is going to be the element, isn't it?
Pardon?
Desertification is going to be, increased desertification is going to be a key element of climate change.
Yes, but the point is that not the entire area will become like that. And given how little we've put into, so for example, less than 5% of African lands are irrigated.
Yeah.
Okay. So all I'm saying is that there's still potential in terms of intensification of production. And so if we can think through kind of sustainable intensification of production, I think countries can respond in ways that can manage the climate change, right? Or that can respond to climate change.
Well, hopefully, I mean, the story about the relative success of Africa will get out there, and Africans will feel encouraged and empowered as a result of this.
Yeah, I mean, that's the challenge, right? The challenge is actually Africans learning from their successes and taking their own successes seriously. And presently, African policymakers often don't turn to their own successes. They turn to outside models of industrialization and transformation. And I think they need to take what's going on in their own countries a little more seriously and focus on that as potentially one of the ways in which they can figure out a path going forward.
Brilliant. Well, let's hope, let's see whether out of this some positive feeling about Africa's achievements and capacity arises.
Yeah. I'm going to be optimistic, at least guardedly optimistic, that yes, despite the challenges, we don't want to deny the challenges that exist for African countries. So we don't want to have just rose-colored glasses. There are significant challenges that exist, but there are also significant opportunities. And I think round the edges, different groups and different countries are beginning to grasp these opportunities that exist.
Brilliant. Well, I think that's a good point to end. And let's see how things go over the next 3 months. And I look forward to talking to you again then.
Yes. Thank you very much.
Thank you, Mwangi.